The vaping epidemic in the US really took hold, I'd say, in August, and there were hundreds of cases across the US. The peak of the epidemic occurred in August, September, October, and then the number of cases declined. Overall, to sort of mid-January, there have been over 2,000 cases of vaping-induced lung injury, and about 60 people have died, unfortunately. The good news, if there is any good news, is that it was all put down to vitamin E acetate and cannabis, and the e-cigarettes had been manipulated or tampered with, and those two constituents were found in the majority of people who had e-cigarette related lung injury. I'd say the other good news, for the vast majority of people who did survive, it was mainly through stopping, obviously using the e-cigarette, and the passage of time and steroids, although a lot of them ended up on the intensive care unit. So overall, it's a terrible epidemic, but it was because specifically people had been tampering with their e-cigarettes, putting in cannabis and vitamin E. So the symptoms of people who had vaping-induced lung injury were fairly non-specific. So from a respiratory standpoint, they had cough, shortness of breath and chest pain. They had symptoms in their abdomen, including abdominal pain, nausea, diarrhea, were the main symptoms. And then also people had fever and chills. So all of these symptoms are relatively non-specific. People with sepsis might have it. People with receiving systemic anti-cancer therapies may have it. So it was pretty impressive how they picked it up. Now, in terms of the risk in the UK, we have the yellow card system, the MHRA yellow card system. And to date in the UK, there have been very few incidences of people reporting side effects from e-cigarettes. So at the moment, there's no evidence of any big epidemic going on. But, you know, would I be surprised if there were odd cases of, for instance, hypersensitivity pneumonitis? No, in fact, there have been a handful of cases of lung injury related to e-cigarettes, we think, in the UK.